Welcome back to Foundation Physical Therapy's YouTube channel. Today we're going to go over a great stretch to stretch out hip flexors, quads, or at least one of the quads going down the front of the leg, and it also really helps out with your IT band. It's called a modified Thomas test. It's really more of an assessment, but it's also a great stretch. So to do it, it's very simple. What you're going to do is, this would be the head of your bed at home, this would be the foot of your bed at home. You're going to kind of sit side saddle on the edge of your bed. And then what you're going to do is get close enough so that you're going to lay back. So you want to get close enough to the edge so that the back of your knees aren't hitting the side of your bed when you do. And what you're going to do is just simply lay back here. And you're going to go until you feel your lower back get flat on your bed, right? You shouldn't be arching your back when you do this. Then what you do is simply hold one leg up so your back remains flat, and then drop this other leg down gently, okay? Now, if your hip flexors are really tight, what can happen is your leg will kind of stay up in this position. Ideally, you want the back of this leg to be parallel to the surface, kind of like this, right? The other thing you're going to do is you're not going to hold this leg out straight like this. You're going to let it hang down. And if you find that it hangs out really straight like this, what you can do is add a little bit of knee bend to this, and that'll engage all of this stretch in here. Another thing to be mindful for is if this leg is out to the side, that can be the IT band being very, very tight. So you want to focus on kind of bringing that back up, letting it drop straight down. And again, you reach kind of for the floor a little bit, you'll feel your glutes engage, and you add a little bend in the knee, and that should trigger all of this stretch. At no point should you feel any kind of back pain. It should really just feel like a comfortable stretch here. Now, the other things you can do if it's really tight is just hang out here for 2 to 3 minutes and just let it hang. Don't hug this knee so far up that it pinches here, but just let this hang down. And then once you get to the point where you've been doing that for a week or two and it seems like it's hanging a little bit better, then you can add the movement of reaching for the floor and then adding a little knee bend without letting your back arch. Really great stretch as just a maintenance activity or after exercise if you find that you're chronically tight in your hips. Also a great activity for people that sit in a chair all day. If your job forces you to be at a computer, which many people do, it's a good way to just kind of relax and let your hips open up. As a point or just a separate little tip, what you can do if the edge of your bed really tends to kind of cave down and you can't seem to get a good shelf on it or a good edge on it, what you can do is take a piece of wood or a large book or even a large cutting board at home, slide that underneath your comforter, and then put that pretty close to the edge. What that'll do is it kind of acts like a snowshoe to distribute your weight, and you'll maintain a nice edge. So that's your Thomas test. It'll really help out with rectus femoris, your IT band, your hip flexors, to some extent your Sartorius, all muscles that kind of live in this front of the thigh. Fantastic way to stretch. So again, we remind you that movement is a gift, and we hope that this helps you enjoy it.